So, welcome to our vaccination conversation. My name is Dave Reiss. I'm the Director of Faith Formation here at San Pedro Presbyterian, and I'm here with Dr. Renee Matos. Renee has been a member of San Pedro for about 8 years. She's has been a pediatrician with the U.S. Air Force. Are you still a pediatrician with the U.S. Air Force?
Yeah, I'm active duty. I'm a peds intensivist. So my disclaimer is that anything I say today are not the views of the U.S. government, the Air Force, the Army, or anybody else associated with the military.
Excellent. Yes. And yes, I guess as also is not the view of San Pedro Presbyterian. We're just talking about, what's going on in this world. And you've also been working on the COVID-19 practice management guide for the Department of Defense. Is that correct?
Yep, that's correct. Yes.
Yeah. And what is that? Just maybe give me a little bit of information about what that is.
So at the beginning of the pandemic, there were several of us that realized that there was sparse literature out there, but it was very difficult for sort of clinicians and leaders and everybody to sort of find it. So we grabbed together a bunch of people there. I think there were initially maybe just 20 or 25 of us. And we compiled as many of the resources as we could to kind of put together a set of clinical practice guidelines, or what we called it a practice management guide for the Department of Defense. And so we did that initially. The first was published in mid-March. And then I am just putting the finishing touches on version 7. So it has really consumed the last, and now it went from, maybe 50 pages. I think the first version was just shy of 50 pages. This one is now 200 pages, and there's over 160 authors. So yeah, it's gotten quite lengthy, and it's quite a process now. But I think this is going to be the last of it. I'm done.
You're done. It's done, or you're done with it?
All of it. All of it's done. I'm done.
That's good. Yeah. I'm glad. So just so everyone is aware that this is just a conversation for us. I think that there people just have questions, and sometimes it's nice to have somebody that you can talk to, where you can go on the internet and you can read probably a lot of what we're talking about, but we also kind of who can't always don't know exactly what the sources are, and you don't know exactly how that will play out, but what you're going to get. So we're just kind of talking. Renee, you have a lot more information about things than I do. That's not my field of interest or my field of expertise. So we just wanted to talk with you, just get some thoughts and ideas. But we also want to think, if you're still wondering and thinking about the vaccines, that make sure you talk with your doctor and other medical professionals and kind of pray about it and trust in that. Don't just take our word for it, but do more research as well. Yeah. So why don't we just Renee, why don't you just go ahead and take a moment and introduce yourself? Tell us a little bit more about who you are, and yeah.
Okay, sure. So I am an active duty peds intensivist in the Air Force. I've deployed a couple of times, actually deployed for COVID. I think the day after I got married last April. So have been mostly stationed in San Antonio for that time. I do a lot of quality improvement. I work with the DHA critical care and trauma clinical community to try and standardize some of our processes that we have throughout the military across services as we combine into this Defense Health Agency. And I am, I'm divorced and remarried, and I now have 7 kids. And I don't know what else. I'm originally from California, and I've been in San Antonio here for a long time though.
Well, excellent. Yeah, I can, think 7 kids during the pandemic has got to be quite crazy.
Yes, it's been busy.
That's good. I mean, that's kind of at least keeps you something to do, right? Beyond work and everything.
Never a dull moment over here.
Yeah. So let's kind of, while our main focus is, about the vaccine and just kind of talking about that, let's kind of back up just and think about, just the onslaught of it all, right? When you first heard about COVID, what were your thoughts? What were some of the things that were going through your mind? And did you think things were going to really turn out this way, the way things are? Were you surprised about all this?
Yeah, it's interesting. So we were on spring break actually in California. We were visiting my parents, and we were at Disneyland actually when I started hearing a lot about COVID. And my husband had asked me about it, and I was like, I'm sure it's nothing at first. And then I started hearing, I participate in several Facebook groups of other physician moms that are intensivists. And I started hearing more and more about this across the world, and that it was actually quite a big deal. And I started reaching out to the other DHA and DOD critical care docs and said, we need to do something about this. We need to be prepared. There's something like, this is a big deal. And that's when the conversations, and it was funny because the chair of our committee who I reached out to was actually in Costa Rica on vacation. And so I'm like trying to message him, like, we need to organize here and try and figure out what's going on, because, the military is very much set up for trauma and how to deal with trauma. But this is the first time that a really medical pandemic has been at the forefront of military medicine. And it has really changed the way we've thought about things a lot. So that's been an interesting process to sort of walk through as well. But yeah, so we cut our vacation short. We didn't end up going the last day of Disney, and we came back to my mom's and sort of stayed put. We're very careful with hand sanitizer, and went back on the plane and everything. But and then we were kind of stuck there in our house for a while. So I didn't imagine. I don't think, looking back, I would have looked forward a year and said, this last year, I don't think anybody could have quite predicted that. Yeah, it's been an interesting year for sure. And yeah, walking this whole process over the last year, has been an interesting.
Yeah, it
It is,
really
yeah.
has. It really has been. Yeah, so as we think now, we've kind of we've gone through this year trying to figure out how to handle it, right? And we're all waiting for this vaccine. So can you just explain, because a little bit how vaccines work in general, and maybe just kind of you know and maybe compare that to what is this COVID vaccine?
Yeah, so the first two vaccines that have been released, the Moderna and the Pfizer, are both really interesting in terms of technology and efficacy. I think it's probably, I would say, hands down, the best vaccine we've ever developed in terms of scientists. I mean, I obviously had nothing to do with it. Somebody asked in the chat if I ever any relationship to the Operation Warp Speed. So I not only do not have any relationship to Operation Warp Speed, but I also, I guess they've changed that term as well. And so it's now the federal vaccine program or something like that. Because I think people thought that the connotation was that things were rushed, and that really wasn't the case. So in developing these mRNA vaccines, that technology has been around. They've been working on it for the last 30 years, which is really interesting, because they're able to take, if they just have that information, the genetic code basically of the virus, they're able to then develop a vaccine so much faster than before. Because in the past, people are working with either live or dead viruses, and they're growing it in eggs and chicken eggs, and those things take forever. And so the ability to use an mRNA vaccine is actually really amazing, that they've been able to kind of carry it to fruition, because the technology is so good. And then I think, that being aside, these vaccines are more efficacious than any vaccines that we've ever had. I mean, usually, if a vaccine's 60%, that's great, but these vaccines to be 95% effective, I think is amazing. And I think so much better than anybody thought. I think, somebody had asked if there was, if the vaccine, if once you get the vaccine, if that can, if you can infect anyone with any viral particles. Well, then the amazing thing about this vaccine is there's no live or dead virus. There's no virus at all to transmit. Basically, it's teaching your body how to make these spike proteins and create an antibody or a immune response to those proteins. So it's really just reacting to those proteins itself. And so then anytime it sees those proteins, it says, oh, that's foreign. Now I'm ready to fight that because I've seen those before. And so that's how the vaccine works. And I think it's so great because it's a little bit more generic in a way too. I mean, so some of these variants, it's actually effective to those variants because a virus's job is to mutate and to replicate in a host. And the fact that these vaccines are still working against some of the variants, I think is great. Does that help in terms of
Yeah, I think that helps. So where was that? So then, so what about these two? So there's two, is there a difference between Pfizer and Moderna? Is it one better than the other, or is it just kind of
Yeah,
different
so
style?
those two vaccines are pretty similar. They're both mRNA vaccines, so the way that they work is very similar. The efficacy is very similar. There's a difference in the dose. So the Pfizer dose is a lot lower than the Moderna dose, but that hasn't played out in terms of a difference significantly in terms of side effects. So the Moderna dose is a lot higher than the Pfizer dose, but that doesn't mean that people have way more side effects with that one or that it works better. So the Moderna dose, just after the first dose, it's like 80% effective. And then with the second dose, it's 94.5%. The Pfizer is around 50% with the first dose and 95% with the second dose. So I would say in terms of the two, it's really a wash. So in terms of my family, my husband and I got Pfizer. My mom and my stepdad got Moderna. My grandmother got Pfizer. Anytime anybody asks me, I say, get whatever vaccine is available to you first. Like, I don't think that there's any, it's really a coin flip between the two vaccines. So I think whatever phone answers and whatever website you can get into, that's the vaccine for you. And that's, like, other than that, it's like the Pfizer doses are 3 weeks apart. The Moderna doses are 4 weeks apart. So if you're in a rush to get vaccinated and you truly have the ability to get, like, they're both literally in front of you, then sure, then get the Pfizer because you'll be vaccinated, you'll be fully immune 2 weeks before the Moderna. But other than that, I don't think that there's any benefit from one or the other.
Okay, excellent. And what about, and there's, I guess, the other ones that they're talking about, I guess there's a Johnson and Johnson one, and are they all kind of the same technology?
They're not, actually. So the technology between the other vaccines is really interesting, and I don't have it in front of me, but there was a nice comparison chart that I had seen at one point. So some of them are using different proteins, like the Novavax, I think, is using a different type of protein. It's not mRNA, but it's a different sort of protein. It's a similar type technology. My mom had started to participate in that vaccine trial, actually, because she was just in a hurry to get something. And then once the Moderna became available, she withdrew from the trial. And I forget how the Johnson and Johnson works. I know that the benefit to the Johnson and Johnson is that it will be more widely available because it doesn't require the same cold storage. The Pfizer is really ultimate cold storage, and it has to be sent in larger groups of like 900 doses. The Johnson and Johnson doesn't require that, so which makes it more accessible, especially in more rural areas. That also being one dose, I think that's a lot nicer too. The efficacy is not as high as the Pfizer and the Moderna, but it still is very high, and especially against severe disease. So I think that that's also really nice that it's very efficacious against severe disease. I think that, we can all get over a cold, but what we don't want is to end up in the hospital or the ICU or to die from this virus. So I think that so I think that I will take that it's very efficacious against severe disease.
Excellent. So then with that, is then the vaccine a cure? Is that what that
means? So the vaccine is not a cure. And the thing that they still don't know is how long immunity lasts. So, and that's true for natural disease too, right? Because this virus has only been around a year. So we don't know, how long people's immunity lasts. So, the new CDC recommendations, they just came out with new quarantine guidelines that said, if you're fully vaccinated, so if you're 2 weeks past your last dose, and then you are less than 3 months from your from when you got it, then you don't have to quarantine if you're exposed to the disease, somebody with COVID. So then what that means is that they're not really sure if the immunity lasts past that 3 months. Now, I'm hopeful that it does, and it's just because that's when the trial ends, and so they're needing to follow that out a little bit further, because I can't imagine that the vaccine will only last for 3 months. But I think that that's the question is, how long the immunity lasts. And I think that's the question with natural disease too, like how long will the immunity last from the natural disease? And if you get the natural, if you get COVID and you have a variant, you're exposed to a variant, then you really are susceptible to that new virus again. Unlike, when it's triggering the protein, which covers most of the variants, that's a little bit different.
Oh, wow. Okay. So then I guess if we got it, you said for 3 months, or where someone was asking then if we're effective, do we have to wear masks? Do we have to take on handle all these protocols?
Yeah. So the reason that I think there's a couple of reasons why you still should wear a mask after you get the vaccine. So one is that you want to be a good citizen. And that really is what this comes down to, for both reasons, honestly. So one, I don't get to wear a shirt that says I'm vaccinated. Also, I don't necessarily believe everybody who says they're, like, how do you know if you're walking around the community who's vaccinated and who's not? And so the smartest thing is for everybody to wear a mask, because then you're really covered. I think the other thing is that what they don't know is once you're vaccinated, can I still get the disease and carry it in my nose? Not that will get me sick, but that could get somebody else sick. And so I think that that's the risk. When we still don't have enough of the population vaccinated to prevent viral replication in the host and to prevent that, herd immunity that we want to get to, we still need to wear a mask to protect those around us, and so that we look like good citizens and are doing the right thing to support those around us, and to keep those that are not vaccinated from getting sick. Now, do I feel okay? Like if my in-laws now come over and they've been vaccinated and my husband and I have been vaccinated, it's just the 4 of us, do I feel okay sitting down to dinner with them not wearing a mask? Yes, I do. I feel pretty good about that with all of us have, 95%. But if I'm going to be around anybody that's not vaccinated, no, I need to wear a mask.
All right, excellent. So you mentioned this herd immunity. All right, so can you explain a little bit about what that is compared to, like, this idea of vaccines, or, why, if everyone else.
Sorry, I lost connection for a second.
What was that?
I lost connection for just a second. Sorry about that.
You mentioned herd immunity, right? And so if everyone else is getting the vaccine, what is this herd immunity? Do I need to worry about then getting the vaccine if everyone else is going to get it?
Yeah. So the problem with herd immunity is that, I'm so sorry, I don't know why my printer is going crazy behind me. It looks like somebody printed something. Sorry. So the thing about herd immunity is that herd immunity, one, we don't know what percent of the population we need to have immunity before we can get to herd immunity. The estimations are anywhere between 70 and 90%. So that means that 70 or to 90% of people need to either have had the disease and not be exposed to a variant, or need to be vaccinated. And the problem is that 25% of our population, or like 20%, I mean, it's a good number, are children, right? When the vaccine's not available to them right now, which means that if every single adult in the whole country gets the vaccine, we still may not reach herd immunity without vaccinating children. So currently children are in the trials, but my concern is that there's enough people refusing the vaccine, when it's widely available, that we aren't going to reach herd immunity unless people really all step up and are willing to get the vaccine. And I think we know, from other vaccines, that there are people that no matter how many conversations and how much science and research they do, they're still just not going to get it. And that's unfortunately for people that, that don't have access to it, like my children, for example, because then they're at risk. And although kids typically do okay during the initial exposure to COVID, they usually don't get sick during that initial exposure to COVID. I've taken care of some very sick children that have had the multi-inflammatory syndrome associated with COVID. that happens about 4 weeks after the initial exposure. And most of those kids never had symptoms when they had COVID, but then they come in shock and are very, very sick. And that's my biggest concern, is not that my kids are necessarily going to get sick from COVID, but that they're going to have, this horrible, inflammatory response that ends up in the ICU before they can get vaccinated.
Mm-hmm. And then, so for kids, I mean, I guess they're still, is there a window for when that's going to happen, or is that still like early steps?
Yeah.
You don't have any idea?
So the Pfizer vaccine is approved for kids older than 16, so 16 and up, and Moderna is approved for kids 18 and up, basically. Right now, both Pfizer and Moderna are undergoing clinical trials for ages 12 and up. So my son is actually enrolled in the Moderna trial and has received his first dose of maybe placebo, maybe vaccine. I really hope it's the vaccine. And so he's actually going to get his second dose next week. So I know that both of those trials are ongoing, but they're both 13-month planned trials. So I don't know at what point they'll, decide if there's enough data to be able to release those to the public. But I think it's several months out. I did hear that they're going to start to recruit children younger than 12 soon. I don't know if it's 6 to 11 or if they're going down to babies yet, but that will happen soon. But again, we may be several months, if not a year out from fully vaccinating children.
Yeah. I know my son is not excited about it because he doesn't want to get another shot. It's like,
my son wanted to get the money for the shot.
ooh, now if I told him there was money involved,
yeah, he was all in.
Sounds good. So, so you kind of mentioned it a little bit, but we're in there was a race to kind of find a vaccine. So does that mean that important steps were skipped, so that we could get to this point?
Yeah, they really weren't. The only thing that they did differently this time was that they started manufacturing the vaccine. They started manufacturing the vaccine prior to the studies being completed. So that's the only thing that they sort of did that was different than often vaccines. Usually you'll wait until if something's going to work before you start manufacturing it. But I think they had enough data early on to be able to say, yeah, like, let's go ahead and start manufacturing this, so that they had doses ready at the time of approval. But other than that, in terms of the trial and in terms of the science behind it, no, they didn't cut any corners. I definitely trust the science behind this. And I guess the only other thing I would say is that, but all of these vaccines are under emergency use authorization. And so they aren't fully FDA approved at this point. So that's the only other thing, is that, but there are lots of medications that we give under emergency use authorization. In fact, every medication that we're giving for this virus is under an emergency use authorization, because there's enough data behind it. They've reviewed the data, they've reviewed the science. They say yes, but it hasn't gone through the full formal FDA approval yet, because that can take like a year.
Mm-hmm. Gotcha. Yes.
So I had no hesitation when I went to get the vaccine, none at all. It was like Christmas.
Right. Yeah. That's good. That's good. Now, what about, just kind of like is it going to be, do you think this will be like a flu shot where it's going to be getting like a regular COVID vaccine, or is this a one and done type of thing?
That's a great question, and I really wish I knew the answer to. I really don't. I mean, I hope it's a one and done. If you can reach herd immunity, and then the virus has no host to replicate in, then, so for example, in Australia, they don't even have herd immunity, right? But they really quarantined and locked their country down and are out at the theaters now and not wearing masks because there's no COVID in their country. So, had we done that, would we be in a different position right now? Maybe. But there are countries that have sort of gotten rid of the virus, essentially, like Australia, New Zealand, and I think there's a couple of others. But unfortunately, we're not in that position. And so at this point, we need herd immunity because it's replicating too fast to kind of fix it at this point.
Gotcha. So then if a person who had COVID, do they need to get the vaccine?
I think they do, yes. And it's been interesting. Some of the research that's recently been coming out has suggested that if they've had the virus and they get the vaccine, that one dose is actually may be sufficient. Now, that's not in the recommendations yet, but it seems like it's triggering enough of a response in people that have already had it, that it seems to be pretty good. But yes, I would definitely, if it's available to you, I would definitely still get it, because again, having the virus does not necessarily protect you from getting the disease again. And it doesn't necessarily protect you against all of the variants, and mutations that can develop.
Right. And how you talk about these variants, how likely is that, these variants going to come in? I know there are some already.
Yeah, they are. Actually, I just heard a lecture on this. I think it was on Tuesday. I just pulled up the slides actually, because I learned something. I mean, they were talking about the UK variant, the South Africa variant, the Denmark or mink variant, and then the Brazil variant. And each of those have, are already in our country, but they have difference in terms of transmission, disease severity, detection, and some in terms of treatment and recognition of antibodies. So it is interesting, the different variants that are happening, and that's expected in a virus. When a virus is mutating as fast as this one is, its goal is survival. That's a virus's goal, and the way that it's going to survive is by mutating. And if one mutation means that it's more likely to infect more people, then that's really good for its genes. And so it's going to keep doing that. And that's going to win out, right? Because it keeps replicating, that one's going to win if it's more effective. Or if it's more effective at making people sicker, or whatever the virus does, if that's more effective at ensuring the virus's survival, then that's what, that's kind of how that works. So yeah, but it is looking at, it did look at the different vaccines compared to the efficacy in these viruses. It looks like, so for the UK virus, or the UK variant, there's no significant impact in terms of the Moderna or Pfizer. It looks like the Novavax may be a little bit reduced in terms of efficacy to the UK. It's 85.6% effective. In terms of the South African variant, there is a 2/3 reduction in antibody production with the Pfizer vaccine, and a 6-fold reduction in antibody production with the Moderna. It looks like AstraZeneca is a little bit reduced efficacy, and the Johnson & Johnson and also the Novavax is down to 60% effective. So it looks like the South African one is really the one to be most concerned about. It looks like there's mostly data is still pending on the Brazil one, and then the cluster 5 or mink, there's no difference expected in any of the vaccines. So that was new to me, and I felt like that was kind of helpful information. So getting vaccinated and getting, things moving and as much herd immunity as possible before the South African vaccine is rampant here would be really good. We have had that variant here already. It looks like it's already present in 46 countries and 10 states for that one, including Texas.
Yeah. And what about, so you talked about, efficacy and all that. How do you know if you're one of those 5 to 6% that aren't, is just like, you think you're fine and then you start getting symptoms, or is there something else going on?
Well, I think the good news is that even for those 5%, those people weren't severely sick. So even for that 5%, they may have developed symptoms and got COVID, but they weren't like in the ICU and they didn't die. So I think that, again, that's great news. So even if you're one of those 5%, I think it's okay.
Gotcha. So it might not stop you from getting it, but it will keep the symptoms to a manageable level.
Yes, dramatically lower. Yes.
That's important. That's great. Excellent. Well, I'm going to go to some of the questions that people have sent in ahead of time. And so everyone else, if you have other questions along the way, feel free just to throw them in the chat. But someone asked first that, is there a period, once someone is vaccinated, is there a period of time when they, quote, shed the virus and are contagious? Is that true? I guess you tell me, what does it mean to shed the virus, if you know, and then if that's a true statement?
Yeah, so shedding the virus usually refers to, so that's something that we worry about sometimes with the live flu virus, with people that are immune suppressed. So that is, typically with viruses or with vaccines that are developed with live or dead virus, where they can shed the vaccine or shed the virus. But again, these are not made with live or dead virus, so there's no way to shed this after getting the vaccine. So there's no period where you need to worry about being away from anybody because of the vaccine.
Excellent. Well, that's good. Another person asked, and I say it's kind of also in here about, they came down with, they tested positive for COVID in January. Someone else said they were in December, and should they try to get the vaccine as but how long should they what is this? How long can we expect to have immunity in the meantime?
So it's unclear how long people are immune, and again, if they're going to have immunity to other the variants. So I would definitely get vaccinated as soon as it's available to you, regardless of whether or not you've had the disease or not. Now, some countries are prioritizing people that have not had the virus, before people that have. In our country, we're not doing that. So I would just say, as soon as it's available to you, I would get the vaccine.
Okay. So yeah, is there a window though? Like if I were tested tomorrow, right? And I came down with COVID, and then once I'm all past and past the period, could I go like the next day and get a vaccine, or is that there's just still like a length of time I'd have to wait?
Um, I would have to look at the CDC recommendations for that. I think it's probably on there.
Okay.
My guess is that I would probably wait 2 weeks, but
Mhm.
I don't know that if it says you need to, or if anything, if there's a specific period. That would just be my guess. But again, I would check the CDC guidelines on that.
Okay, excellent. Here's one. For those people who've had the two doses, what precautions should they take moving forward? And this person was asking to be able to see their grandchild or with asthma or just in general. What are some like precautions? Someone else also talked about normalcy, when we get back to normalcy and what that would require.
Yeah, so I think I do see us returning to more of a normalcy. I just don't know at what period that will be. It depends on how quickly we can vaccinate, our country. We have 331 million people in the United States. So even if we're vaccinating, a million or a million and a half a day, again, with 2 doses, that means you're really only,
Mhm.
halfway vaccinating those people. So that's a lot of days till we can get everybody fully vaccinated. So like my math tells me that's over a year. But some people have predicted that, that this summer or this fall, we may be, reaching a point where things are more normal. I do think that children are going to need to be part of the equation in terms of vaccination to reach that herd immunity. In terms of like, being able to be around family members. So what I would say is that I would recommend that you wear a mask when you're around people that haven't been vaccinated. So if you're, I think that that's the safest thing. Is to be, is to wear a mask when you're around people that aren't vaccinated. But certainly you then are protected, right? So if you're worried about your granddaughter giving you the virus and you're fully vaccinated, and by fully vaccinated, that's 1 week after your second dose of Pfizer or 2 weeks after your second dose of Moderna. So you don't need to worry about your granddaughter giving you the virus at that point. But it's possible for you to give it to your granddaughter if potentially there's some in your nose that you're transmitting. I think the likelihood of that is really low, if I'm being honest. I do think it's unlikely that, there's enough live virus that I could be a host that's passing through my nose into somebody else where I'm not sick, but I got it from somebody who's, especially if we're all in masks in general. So I think the likelihood of that is low, but if you want to 100% protect those that you love and around you, then I think the 100% answer is to wear your mask. The like 80% is probably that you're okay.
Right.
Yeah.
Yeah.
I mean,
Maybe to be precautious, better to be precautious.
yeah, exactly. I mean, it just depends on, how at risk that person is. But I can tell you that I was definitely, on the days that I've worked in the pediatric ICU, I've been shocked that basically half of most ICUs are filled with kids. Pediatric ICUs are filled with kids with the MIS-C. So that is pretty much what we're seeing in our ICUs right now.
Wow.
Especially after the kind of Christmas spike. That was significant.
Gotcha. What about my just thought that came to my mind is, we're talking about us here in, first world America, right? Just getting this vaccine. What about, and maybe you don't have an answer, I think about those people that live in, second, third world countries that are like, I know I saw something today about, I think it was Ghana. They were rolling out like a thing in Africa. But what about these countries that where, first, how is it going to, is it caring for those people? But if it's not, is that going to cause more spreading? If we've all got the shots, but a third of the world isn't because they live in, or even more because they live in poverty and things like that. How is that going to play out?
Yeah, I think that's a really good question. I don't know the answer to that. I think, yes, we live on this planet with people from all different countries. And so for us to be completely isolationist and thinking that we can just vaccinate our country and we'll be good to travel around the world again, I think that's pretty naive. This planet we share with lots of people. And so we do need to consider the importance of vaccinating other people unless we are really going to close our borders and not travel, which I can tell you that being in the military, even during this pandemic, I've been to a couple of different countries in the past year that I've been sent to. So I don't see that happening, just because our military alone is still moving and having to move for different things. So I don't know the answer. I think that, it is important for us to think about that and to make sure that we're, helping to vaccinate other countries that don't have the resources that we do as well.
Excellent. Yeah, I think, thank you. Really, that's all the questions I've got. If there's anything that you think that we should have addressed that we haven't?
Somebody asked in the chat, what does it mean to shed the virus? So what I mean by that is if you're carrying it in your nose and it comes out of your nose, or if you sneeze or cough or anything like that, that means that you're able to transmit that virus to somebody else. So that would be, basically you're transmitting the viral particles to somebody else. And so that's the whole idea of staying 6 feet away from anybody else, is that it's really hard to cough or sneeze more than 6 feet to include a viable drop, especially if you have a mask on. But that's the idea between both the social distancing and the masking, is that it's unlikely you can really project particles that far.
All right. What about this has nothing to do with vaccine in a sense, but there's the double masking.
Yeah. So I do think there have been studies looking at the different effectiveness of different vaccines. So obviously the N95 is most effective. But it is interesting because, when we wear N95s in the hospital, we have to be fit tested, which means that they put us in this little hood and they squirt a bunch of stuff in there and make sure you can't sense it or smell it or anything. When I see people wearing N95 masks in the community, it's like, they're kind of moving them around their face and there's holes and gaps and stuff. So I don't know how effective they are in those settings. If they're not being really truly, you're supposed to have a complete seal with a true N95 mask. But they are probably better than, cloth masks or other masks. But the idea is to really have a good seal. The next most effective would be your surgical masks, like your hospital disposable surgical masks. And then the idea would be to have masks with filters or double masking. That's been shown to be more effective as well. If you're wearing cloth masks, the idea is that you want to wash them and change them regularly. You don't, the gaiters have had low efficacy. So the particles, it's easy for particles to get through a gaiter. So the things that people just kind of wear as a sleeve over their head. And then the worst ones are the ones with the little filters on them, the little valves or whatever, because those basically transmit everything out of your mask. So those, if you ever see somebody wearing that, it's essentially like they're not wearing a mask. So it does keep things from coming in, but it doesn't keep anything from coming out. So so those are not allowed at my kids' school or at my hospital or at the, you know, in the
Yeah,
military at all.
because people thought, oh, that's a good idea.
Yeah,
And then it's like, oh wait.
yeah. So there is a difference in terms of masking.
Mhm. Excellent. I guess, yeah. Thank you so much. And if there's anyone else have any questions, we'd love to, type it in now, or forever hold your peace. Not just kidding. But yeah, well, thank you so much for sharing your thoughts with us and
Sure.
your what you've learned. I know it was helpful for me because like I'm not a medical stuff is not really my forte, so it's nice to hear from someone who that's your job. You're in that. So thank you so much.
Absolutely. Yeah, and I'm happy to stick around if anybody has any other questions or wants to unmute themselves or ask them. I'm happy to. If I don't know the answer, I'll send you to the CDC website. But
Excellent. Yeah. Well, thank you.